Hello, everyone. Thank you for joining us today for today's webinar topic, 2025 Healthcare Trends, Driving the Need for Analytics. My name is Nicholas Rodriguez. I'm the National Sales Manager here at Practical Data Solutions, and I'm pleased to have joining me Scott Everett.
Thanks, Nick, and thanks for joining us today, everyone.
All right, so why don't we just go ahead and talk about today's topic. We're going to be talking about what's really shaping, what's going on in healthcare, some of the trends, and how organizations are using, both data and analytics to stay ahead of the curve on these trends.
And really what we want to focus on is it's all about balance, and it's balancing the perspectives of what's going on and making sure that it's backed up with real actionable data that's out there.
Absolutely, absolutely. Before we, go right into this topic, for those of you who aren't familiar with Practical Data Solutions, we're a healthcare reporting and analytics company who's for more than 24 years now has been helping organizations, with things like data warehousing, analytics, reporting initiatives, anything to be more data driven to come out ahead around these types of trends we're going to be talking about today.
So as we go throughout the webinar today, if you have any questions, please feel free to chat those in utilizing the Q&A toolbar, and we will answer those questions as we go through the webinar.
Perfect. And with that, Scott, I'm actually going to turn it back over to you to kick us off on our first topic, which is the CMS and Medicare changes we've been seeing.
Yeah, so as part of the physician fee schedule rule that was put out for 2025, CMS did make a number of changes to the way that they'll reimburse providers. Now, obviously, the big one we're going to talk about is the RVU conversion factor was decreased about 3% to 32.35. Now, the good news with that is that they've extended the Gypsy workflow, so you'll never get below that conversion factor. That said, there are some implications to that conversion factor that I think it's important that we have the data to understand. So what's important is to really be able to model out and forecast how is this decrease in reimbursement going to impact us? And really, we probably want to look at it at a departmental level. We want to understand which of our departments has our highest Medicare population that they're treating. What's the overall volume, and how's this decrease going to impact us by specialty, by department, by division, maybe even by provider, if you want to get down to that level as well. And so being able to model this out and forecast so we understand the impact is really what's going to help us be able to navigate something through this. In addition to that, there were some changes to telehealth services that were defined. Now, these have been extended, but only until the next bill that comes out, and they may be taken back at any time. These telehealth services were implemented during the COVID pandemic, and they've approved more services then for telehealth and telephone than they want to keep permanent. So sometime they're going to roll these services back and no longer approve them by telehealth or telephone. They'll have to be live. So in order to understand that, we really need to make sure that we're looking at where are we seeing our patients, what percentage of our patients are being seen by telehealth, and are these services ones that we need to make sure that we are addressing with their patients, and understanding that going forward, those are going to have to be services done in the clinic.
Yeah, we've also seen the addition of 6 new MIPS value pathways, specifically for specialty care. So, we've seen a lot more specialty type organizations, focusing more on their quality metrics and quality reporting. So they might do, report something like this, for example.
Yeah, some of the new MIPS metrics are very specialty based. They're looking at orthopedics, ophthalmology, and dermatology, like you're seeing here. And what we're seeing from organizations is that they're starting to take more of an interest in this quality reporting. The difficult part is quality reporting is kind of hard to define. What is it that we want? What do we want to report on? And our recommendation is, if you're not certain, start with MIPS. Look at these different quality indicators that are being put forth by by CMS. Look at these individual metrics and start measuring your providers, who is doing well and who are providers who are maybe struggling to meet these quality standards, and help them with what they need from a resource standpoint to be able to get to where we want to be for a target as an organization.
Yeah, and quality, reporting and quality metrics really seem to be at the forefront for 2025, especially as we talk about value-based care, which is our next section here. And, we've seen a lot of growth in value-based care. We've seen a 25% increase in provider participation from 2023 to 2024. And the global value-based care healthcare market was worth 12.2 billion in 2023, but it's expected to grow to 43 billion by 2031, believe it or not.
Right. And really the key for transitioning to value-based care is this: understanding our patients. We need to make sure that we're looking at patients that have chronic conditions, that they're being appropriately seen for follow-up care, that they have care plans in place, that they're in compliance with those. And so what we want to be able to do is stratify our populations. Now, there's a good way to do that from a risk standpoint is utilizing HCC risk scoring. And what this allows us to do is identify patients that are at high risk, moderate risk, and low risk for incurring high levels of cost. Now, we can look at it and we can see these patients that are at risk, and we can try to identify, the things that we're seeing them for, the particular conditions that they have, utilizing a visualization to, help our providers look in summary. But it's important to move past just what we're doing from a create report standpoint. We want to be able to care for our patients better and utilize the data to do that. And one of the ways we can do that is by understanding who are our patients who haven't been in for a while and need to come in. So again, we can start looking at our highest risk patients. We can see who's past due for a follow-up appointment or a wellness visit. We can see if they have an appointment scheduled in the next 3-6 months coming up. And for those who don't, we can create a work list very easily of who we should reach out to and maybe be even a little bit proactive in our scheduling and care for these patients.
Which really brings us to our next section, which is, practice costs and labor shortages. And, unfortunately, I wish I had some good news to report, but it looks like costs are continuing to increase this year as they have in the previous years. In fact, we saw an 8.8% investment required to support a physician practice from last year. The median direct expense per physician increased 9.8%, but there is a silver lining. Median net revenue per physician did increase by roughly 9.1% last year as well. So a little light at the end of the tunnel, I suppose.
Yeah, and when we're using costs, it's interesting because when I talked about value-based care, we talked about the risk for incurring costs. There's different costs in healthcare that people are always talking about, and I think it's important to differentiate between all of these. There's the cost that payers incur, and that's what we were talking about with value-based care. What are they build? What are they paying and reimbursing for the care for the patients in their networks? But there are also costs that patients incur, including the premiums that they pay to the payers, as well as what they're paying in out-of-pocket costs to the providers via deductibles, via coinsurance, things like that. And when you hear people talk about, oh, we've got to reduce healthcare costs, those are usually the two that people are concerned about. But there's a third cost out there, and that's the actual cost to provide care. What does it cost us as medical practices to provide care? And those include things like salaries and benefits for our providers, as well as our nurses and administrative staff. We have occupancy costs, IT costs, and insurance. And all of these are increasing year over year, like we're seeing, Nick. And so what's really critical when we start talking about the analytics side of things is to have a good understanding of what are our highest costs. Most of the time, it's going to be salaries. It's going to be salaries and benefits for our providers, though occupancy expenses starting to take on a much higher percentage of the overall cost that they have. And of course, insurance always jumps up as well. But when we look at this, it's really important to have a good understanding of what's out there, make sure that we're budgeting and forecasting effectively. And we really need good data and good analytics in order to do that. We need to be able to understand this by specialty. And if we can, It'd be nice to be able to even get it down to the individual provider level when we start looking at direct expenses and how we can allocate those and start looking at physicians from an income as well as expense side of things.
Yeah, Scott, and I'm glad you mentioned salary as one of the costs. One thing I've been hearing from a lot of organizations when it comes to the cost discussion is the cost of recruiting a physician, and how much more of a burden that's become for practices. We've seen recruiting costs range from 180 to $250,000. When we take into account both direct and indirect expenses. So when thinking of those, a direct expense could be a search fee or in-house staff cost to recruit physicians. It could be candidate site visits potentially or relocation expenses. But then we've got some, indirect expenses, things like, residency or fellowship stipends, sign-on bonuses, housing assistance, retention bonuses. And part of the reason, recruiting costs have really risen in the past few years is due to the labor shortages we're seeing.
Yeah, and labor shortages have an impact not just on the physician side, but there's shortages of nurses, there really shortages of everything that's out there. And so we really need to look at the best way we can cut the cost of our salaries by retaining the people that we have and drive up our employee engagement. And so what it means for us to be able to help look at and retain these employees is making sure that they're engaged from a productivity standpoint, making sure that they have the data that they need to stay productive and remain that way. We need to look at employee turnover costs. Like you said, Nick, that it's really important to keep the people that we have because it costs us more to recruit a new provider or even a new employee than it does to retain a current employee. And so really looking at our turnover rates and looking to drive those down, looking into understanding what our recruiting expenses are and what are those kind of intangible indirect costs that you talked about before as well, Nick. And so when we're starting to look at how we engage our physicians, looking at their overall compensation is really kind of a critical piece of how we can engage them. What they want to do is they want to feel like they have some control to self-manage to the compensation levels that they want to get to. They want to be able to have the data in front of them to let them know what is it that they can do a little bit differently to increase their productivity, whether it's an RVU based, whether it's a collections based, or whether there's quality components to it as well. We want the physicians to be able to self-manage their productivity.
Yeah, Scott, and you bring up a great point, because we talk to a lot of different organizations out there, and one common thing I'm seeing is, oftentimes, compensation reporting is in one department, physician productivity might be in another department, and a lot of times, the two aren't in sync when they really should be, right? If we're talking about engaging our physicians, making sure they're, staying with us longer, it's really key that these two are in alignment, that the providers know what they need to do to improve their compensation, if that makes sense.
Yeah, absolutely, Nick, and I agree with you that this can't be a differentiated thing. This is something that providers need to have the information. They can't be trying to run on guesswork and just see patients and be happy with what they get. They want to be able to direct the way that they practice in order to make sure that they're feeling productive and happy in their engagement with the practice.
All good points. All right, with that, why don't we move on to our next section here, which is the increase in mergers and acquisitions we've been seeing. So despite a slowdown in 2024, healthcare mergers and acquisitions activity is actually 70% higher than it was pre-pandemic level. And we've seen the deal value tick up quite a bit from 63 billion to 69 billion.
Yeah, this is something that we're seeing as a big trend is private equity coming into the healthcare space, and the big thing that people are looking at with that the they're looking to reduce costs. And this one again is back to the payer cost, because what they're seeing is that the private equity backed practices were about 9.8% lower on Medicare expenditures per patient than other practices were. And so really looking at this coming in, the cost factor is coming into play with that. Now, the problem that we have from a data standpoint is as we merge, as organizations are acquiring, now all of a sudden they have a big jumble of data from multiple different systems that they've got to try to organize and get to where it's supposed to be.
Yeah, and great point, Scott. We're seeing a lot more data to your point. Organizations are tasked with the challenges of, we just acquired a new practice on a different billing system, or, we have new EHR data. So it really can be a big challenge to, determine how do you make sense of all this new data? What's the best way to, what's the best strategy to tackle all this new data, right?
Yeah, and really the ability to blend data and be able to visualize across multiple systems is a big thing. People think that it's just a matter of, oh, you have one system here, one system there, that's two systems, and it's not true. You have three. What we're looking at is you have to have system A, system B, and then you have to have an aggregation of the data between the two. And so really being able to blend data in visualization is something that is supremely critical for these organizations, because they can't be running blind on just one side with the data that they have. They need to be able to blend it from every source that's out there.
Yeah, and it also kind of begs the question of, talking about data strategy, right? What is the best approach now that we've merged, or, whatever the case might be for your organization, which brings us to our next section, which is, data-driven management. We're seeing a lot more organizations, coming up with strategies around data rather than just, the typical get the report out because I need it today, right? So it's become a lot more strategic over the years. But what does it really mean to be a data-driven organization? Let's explore that for a second. So, being data-driven is the continuous use of data to, uncover opportunities to improve, but, and then using those insights that you've learned to basically start over. You're continuously using data to refine and then revisiting that as you refine, right?
Yeah, and really it's important when you look at it that again, it's about balancing the perspectives that's out there, where, leadership may think this is what's going on and the physicians may think this is what's going on. But what's really important is that we have the data to back it up. And so this means that we're taking data from these systems and we're talking about the data in our meetings. We're utilizing the data to formulate our strategy. We're making sure that people who need data to make decisions to run the organization have access to it themselves, that they don't have to wait hours or days in order to get to what they need, that they have self-service analytics, and that they can get everything that they need when they need it, and that it's easy and simple to use.
Absolutely. And we talked about some common characteristics, of data blending. Scott, I know you just touched on a few. Or I'm sorry, some common characteristics of data-driven management. And Scott, you touched on a few, but a couple things like data blending, custom KPIs, visualizations, automation. All of these things though really need to be leadership driven. And in fact, we often talk about what we call leadership KPIs. Because one thing we've learned in healthcare in our 24 years of experience is that a one size fits all approach doesn't really work, right? Every organization's unique. And in turn, what leadership's asking of data, has to be unique, and, what they're getting back has to also fit that mold.
Right. And when we talk about data, we need to talk about tools as well, where different people need different things. When we talk about data, we talk about the analytics trio, where you have the visualization piece, but then the visualization piece may lead to more questions where you need the slice and dice analysis that needs to be fast and easy to use. And then you get into the queries where you're getting to the patient level and invoice level, transaction level detail. And ideally, you want to be able to move between the three of these fairly seamlessly. And so we start talking about, Who needs the visualization piece? Well, that should go to, physicians, managements, executives. But again, when they raise a question, why is this looking the way it is? Why is this trending in a direction I don't want to see? That's when you need to be able to go into that cube analysis or OLAP analysis to be able to slice and dice quickly, find your outliers, look at ratios, apply filters and calculations. And then once you get there to be able to, provide that detail level reporting and again, moving between the three is really pretty critical.
Yeah, and while we're on the topic, Scott, I did want to just, touch on visualization because it really does seem to be a big focus for organizations, especially with the popularity of tools like Power BI and even Tableau, for example. But some of the real big benefit of data visualization is being able to analyze data quickly, right? You can do, ad hoc analysis on the fly. You can quickly change your visualizations. A picture speaks 1,000 words, as they say, right? It's much easier to see trends when they're right in front of you rather than looking at, numbers sometimes.
Yeah, so when we talk about the key ideas that we're looking at here today, we've given you some trends that are coming about within the healthcare industry right now. And so really the goal is to make sure that you have the data necessary to be able to navigate those. So we've covered a lot of ground today, and we know that organizations out there have challenges with being data driven and getting access, and PDS can help. We talked a lot about modeling the reimbursement changes that have come in Medicare.
Yeah, and one way Practical Data Solutions has been able to help organizations over the years is, like you said, Scott, modeling those reimbursement changes, looking at the different payers out there and seeing, how are they reimbursing us, even compared to Medicare potentially.
Yeah, and then of course, productivity is always going to be a challenge that will never change. But things ranging from custom RVUs for compensation and calculating those to adding quality measures are things that we're familiar with as well.
Yeah, and when it comes to mitigating turnover and retaining your employees, we talked about one of the big ways that PDS is helping organizations do that is by providing them with more engagement through enhanced physician productivity and compensation reporting, so they can really better self-manage to see where they're at.
And then, of course, with that jumble of data, whether you're blending data or not, you have a lot of data that you're working with. Being able to blend data, consolidate it into individual and single reports, getting people access to the data that they can utilize to self-manage is something that we have a lot of expertise in doing as well. So with that, we want to thank you all for your time today. If you have any additional questions, please feel free to chat those in utilizing the Q&A toolbar, and we'll be happy to answer those before we leave today.
So with that, we wanted to thank everyone for joining us today. If you do think of other questions afterward, please feel free to reach out to us at solutions@pds-online.com. If you did want more information, feel free to email that same domain or visit our website or our YouTube channel. Thanks again for joining us, everyone. Have a great day.
Thanks, everyone.